You still jump. The clerk will call the roll. Here. Present.
Where's my agenda?
See, even when I beat it, they don't, you know.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Figgis, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Pastor Tim Woody from the City Life Center, Fort Worth. Thank you for coming down. After the invocation, please remain standing for our pledges.
Let's pray. Most sovereign God, I come to you today to pray blessing over this assembly of our Tarrant County elected representatives. I thank you for these commissioners, and I thank you for their diligent work as they strive to govern my great county. God, I pray that as they make decisions today regarding our infrastructure, our transportation and expenditures and the needs of the people, I humbly request the wisdom of God to be present in this room. I pray specifically for Judge Whitley as he presides over today's proceedings. I pray blessing over all the commissioners, bless their work, but also bless their families and their homes, because no one really understands the strain of public service. May our Tarrant County leadership continue to be marked by strong ethics, compassion, creativity, humility, and wisdom. May the Spirit of the Lord rest upon them, the Spirit of wisdom and understanding, the Spirit of counsel and might, and the Spirit of knowledge and the fear of the Lord. Give these commissioners sharp minds with a diligent spirit as they deal with the unique challenges of this very turbulent season. God, I also pray that no plague or unrest or violence or mockery or hatred will ever discourage these leaders. May they use the wisdom of God to come together in a spirit of unity to do what will ultimately honor you in this room as they serve the 2 million residents of this, the best-run county in America. And God, may you be enthroned above all else in Tarrant County. May the glory of Almighty God shine brightly from this place, for we invoke your presence here now. Holy Spirit, you are welcome in this place and in these proceedings. In Jesus' name, amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Pastor, thank you very much. Appreciate it.
Members of the court, we just have a few comments as it relates to the agenda this morning. First of all, we're going to take things a little bit out of order again. As soon as we complete the consent agenda, we're going to ask Mr. Tenasia to come up and make his report before we go through the general reports that we normally do prior to Mr. Tenasia's presentation. Also, members of the court, we are going into closed session today. We have one item that we'd like to discuss with you. And that's it.
Members, you have before you the minutes of our regular meeting of April the 6th. Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. A couple of resolutions. Commissioner Allen?
Thank you, Judge. Well, I will be reading into the record and presenting a resolution in honor of Ambassador Saeed Asani, which is especially fitting given his leadership in Tarrant County and also in the Muslim community that we just recognized the start of Ramadan yesterday. So, without further ado, whereas family, friends, and the community honored the late Ambassador Saeed Asani, thank you, with a road topper ceremony on Saturday, March 27, 2021, to dedicate the Saeed Asani Parkway located on Pioneer Parkway, State Highway 303 in Arlington, Texas. And whereas Ambassador Asani was born in 1929 in Bareilly, India, and after completing his education in India and Pakistan and his postgraduate degree in Montreal, he joined the Pakistani Foreign Service in 1952 and served in Cairo, Rome, Kabul, Beirut, Calcutta. And whereas he served as director in Afghanistan, Iran, Turkey, and the Central Treaty Organization from 1966 to 1970. As Pakistani ambassador to Sudan from 1971 to 1975, and as Pakistani ambassador to Ghana from 1975 to 1979, and as Pakistani ambassador to Brazil from 1979 to 1981. And whereas he was co-founder and director of the Pakistani Foreign Service Academy from 1981 to 1988, when he retired and moved to the United States. And whereas he was a visiting professor at University of Texas at Arlington and Tarrant County College, the chairman of American Muslim Alliance Southwest, an elected precinct chair, Tarrant County election judge, presiding president of the American Muslim Caucus, chairman of the American Muslim Task Force for Civil Rights and Elections Southwest, a community organizer, and a mentor. And whereas Ambassador Asani passed in July 2014 at 85 years old, is survived by his wife, Ms. Sajida Asani, and 4 children, and will be remembered as a pioneer in Muslim activism and political engagement. Now therefore be resolved that we, the Commissioners Court of Tarrant County, pay tribute to the memory of a beloved and dedicated community leader, in witness whereof we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 13th day of April 2021. And with that, I move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And joining me this morning, I did see Mr. Aftab Siddiqui. If you would join me here at the podium.
Good morning, sir.
Good morning. Thank you very much for this honor, for a great community leader for us, for our community, the American Muslim community. And I really appreciate this resolution and the recognition. Thank you, Commissioner, and thank you on the Commissioner Court. Thank you very much for your respect and for really giving us a chance to recognize one of our own. May God bless you all. Thank you very much.
Thank you.
Well, and I would just add, as the resolution shared, that I guess Saturday, 2 weeks ago, there was a dedication ceremony for the street topper recognizing Ambassador Asani, and there were dignitaries from all over and community members. So it was a really great celebration and a good way to kick off the spring. So thank you for everything that you all are doing.
Commissioner Fickers.
Yes, I have a congratulatory resolution that will be presented to Laura Hill, Mayor of Southlake, upon her leaving office. And this will be presented on May 7th, so I would move, this is for ratification only, and I would move its approval.
Second. We have a motion to second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Court members, you have before you the consent agenda.
Move approval.
Second.
We have a motion to second to approve the consent agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius?
We're now going to move to the briefing agenda, and we're going to ask Mr. Tenasia to come forward and present his current and emergency health issues.
Thank you, Mr. Manius, and good morning, Your Honor and members of the court. We have your regular briefing for COVID-19 related issues. You know, first of all, I wanted to point out the map still is looking green in North Texas, so that's great news. But the trend has sort of stabilized, We've been declining since January, and now it looks like we're flatlining. We're not declining anymore. There are 253,000 cases in Tarrant County. I believe we're reporting about 190 or so this morning. 30,327 deaths. Hospitalizations are down to 3.42%. That's 152 people in the hospital with COVID-19. 45 of those are in the ICU, and 78 ICU beds are available. That's a far cry from when we were down to like 6. So this is, completely different picture, more normal-like picture than what we would, expect in a surge. So things are better, definitely. The trauma service area E, again, is at about 3.4%, 526 people in the hospital, and 220 ICU beds available. But if you look at the chart on the bottom, and unfortunately there's no way to zoom to show you the actual trend, but if you look, it's kind of flattened out. It's not going down anymore. I know it's hard to see on those bars, but I have different charts to show you that kind of makes the point. Look at the case curve, the epi curve that we normally use to track the outbreak. If you look at the peak, we had a sharp decline, and the last several weeks have been just at this steady level, so it's flattened out. And then in these other charts that have different parts of the epidemic, visualized on what's happening, the positivity rate has sort of been bouncing between 5 to 7%. So it stopped going lower. We were at 30%, we made it all the way down to 5%, and then we've been just sort of hitting that bottom and not able to break through any lower. In fact, looks like in the community there's pressure building up to go higher. Why is that happening? I mean, we're past spring break, we had the restrictions lifted, all kinds of activities happening across the community. There is moderate level of activity, but it's a sustained level. And that is a concern, that it's not going down anymore, then we're ripe for another surge. The COVID-like illness, it was going down nicely, and now it's kind of flattened out. And I don't like when things flatten out. I like the trend to keep going down. We want to go all the way down to 0. Same with hospitalizations. We've kind of hit a bottom, and for the last 3 weeks or so, we're not going any lower. We're just staying at that level, which could mean trouble ahead. All the other indicators are pointing, and there's one, sort of the canary in the coal mine, that are not. The virus spread rate has jumped above 1. So if it stays below 1, that means we're slowing down, the spread is slowing down. As soon as you cross above 1, that means we're starting to accelerate. So it's 1.01, okay, the sky's not falling, but that is a cautionary tale when you look at all these indicators and your virus spread has increased. That means there's activity brewing below the surface that we're not able to see at this point. I mean, it may emerge at some point. And the reason I worry about this is national trend has turned up decidedly. It's not heading into a spike right now, but it has stopped going lower for the last 2 or 3 weeks. We're making percentage positive gains. Last week there was a 18% increase. This past week, there's an 11% increase. So definitely the trend has resumed upward for the United States. There are 5 states that are adding more than half the cases. So that's Florida, New York, Pennsylvania, Michigan, and I forget the 5th one. But Michigan, look at the spike. And this is despite vaccination efforts and all of that happening. They just kind of caught it at the wrong time. A lot of people went for spring break to Florida, came back. Huge spike happening.
Is Michigan the one on the right?
Yes, sir. Michigan's on one on the right. I wanted to show that because they're at the level that they were at the peak in December and January. So they're hitting another peak right now where their hospital systems are at the verge of, the collapse that we worried about. There's been talk from CDC about Michigan needs to consider stricter lockdown type measures. Not too far from Michigan, in Ontario, Canada, they issued a lockdown for 14 million people in the entire province of Canada. So, there's things happening all across that we need to be very mindful. And if you think, well, we've done a great job vaccinating, we are at 21% or so across the county. Well, Michigan as a state is at 23%, and they still have a surge because there's these other 70, 80% of people that are not vaccinated, not protected. So there's dry powder, right? And it can catch fire. So we need to make sure that we continue to do our part, that we, wear our masks, avoid large social gatherings, still do all those safety measures that we are used to by now, and we know how to prevent this large spike from happening. We just need to band together as a community and keep these levels low. Here's another slide that I added. There was a lot of contention last year. Well, deaths aren't happening. There's 99.9 recovery rate, and people are just making this all up. There were comments made that it's a pandemic. Well, finally, CDC has spoken with the data from last year saying, okay, we've evaluated everything. COVID, at the end of last year, had 345,000 deaths reported nationally. It has become the third leading cause of deaths in the United States. On the right, there's a chart. Heart disease, variety of heart diseases, right? They can lead to death, was number one. Cancer, all cancers combined, number two. And then COVID alone was number three. And of all the infectious diseases, there's COVID and there's flu and pneumonia. That's it. Everything else was chronic illnesses. And flu and pneumonia was like number 8, which it typically is at that level. So COVID came out of nowhere and became the number 3 cause of death in the United States. Age-adjusted mortality has gone up almost 16%. We were declining year over year for multiple years, and last year, as a country, we lost 16% more people on an age-adjusted basis due to COVID. And of course, there's, equity problems. Non-Hispanic blacks, non-Hispanic American Indian, Alaskan Natives, they had more deaths compared to other folks in the community, and the highest death rate was among the Hispanic population. So these are all the data elements that kind of go to prove the point that it wasn't all about just like, oh, the sky is falling. There's real problems when we all don't band together and work towards a single goal. Okay, so global picture, again, job is to look at trends overseas because some places are ahead of us by a couple of 3 weeks. That has stayed true. Globally, on the left-hand side, the top chart, we're in another spike. At the worldwide level, we're reaching the same levels we saw in December and January. WHO issued another alert that this has spiraled out of control because a lot of countries have lifted restrictions early, and there's not enough vaccination that has gone on across the globe to warrant that. U.S., again, different chart, but we are starting upward trend. Hopefully we won't end up in a spike. But if you look at the levels, we're at the levels that we were in July as a country. And we thought that was a bad spike, right? So, it's all relative. Now it looks like, oh, we're okay, but it was pretty bad overall. India, another example, came down pretty hard just with a lot of us. And then suddenly in February, huge spike. And they're just totally spiraling out of control. And so is Canada. Canada's having a big spike. They've reached their levels that they've seen in December and January. So the point of all of this is, there's no champagne in the huddle. Till this is done, we need to continue to do all our part. Restrictions or no restrictions, we know the science behind this. We need to wear our masks, 6 feet distancing, no large social gatherings. And there are, recommendations out there. If you're fully vaccinated, you can meet with other vaccinated people, no masks needed. If there are mixed groups where some are vaccinated and some are not, wear a mask, stay 6 feet away, and then continue to wash your hands throughout the day. So that's all the virus-related or outbreak-related information. If y'all have any questions, I can answer those now before I move into vaccine.
I know you're on short fuse, but are the surrounding counties, our numbers have stayed relatively low, just as you talked. How have Denton and our surrounding counties, are they still staying fairly low?
They're staying fairly low. Similar trend. I got an alert yesterday that at the state level, they're noticing a sort of an uptick in ages 20 to 39. And that could be, post-spring break effect, restrictions got lifted, younger folks, socialize, go to work, all those type of things. So a lot of things happening that could explain that. But again, it's not outwardly visible as a spike. Something's brewing all across the state.
Okay.
Yes, sir.
Vaccines.
Yes, sir. So here's the vaccine update. This is just the chart for availability of clinics and so forth. So the timings are there. One thing I do want to point out, we had AT&T Stadium operating as the FEMA site. Today they're having to take a pause. There was a alert issued by the FDA this morning that they're taking a temporary pause on Johnson & Johnson vaccine. So this site was primarily operating with Johnson & Johnson. They have Pfizer available for second doses only. So people that, got their first dose at either Global Life Park or eSports with Arlington as a provider can continue to go to AT&T Stadium for their second dose Pfizer. But for Johnson & Johnson, we're taking a temporary pause. This was the only site in Tarrant County that I know, that large site, hub site, that was operating with Johnson & Johnson. We've sent out notices for people that had appointments today, saying, their appointments canceled. We're issuing them new appointments at any of our other sites that are using Moderna and Pfizer. And then there's that 10:30 call that I need to go attend with FEMA to see if there's an alternate plan. If not, we will reschedule all of these folks into our other sites. So that's kind of where we're heading.
And I assume that this delay or this pause on Johnson & Johnson is something that also applies to all of the pharmacies?
Yes, sir. All across the country, because they all under the FDA emergency use authorization. So they've temporarily issued a pause on the use of Johnson & Johnson. So all the federal sites that are there, whether it was us or in Dallas or in Houston, all the pharmacies or private providers who may have received it, everybody's supposed to hold on using Johnson & Johnson.
Now, I guess if they later go back and clear that part up, that Johnson & Johnson vaccine is much longer life than either Moderna and or Pfizer from that.
Yes, sir. There's a lot of advantages. It's single dose. It's easy to maintain in the refrigeration. It has a longer shelf life. So there's definitely advantages there. Now, looking at what has happened overseas, multiple countries have done this safety review pause, and they've come back and said everything's fine, let's move forward. Don't know what the FDA is going to say, but I expect that they're going to study this very carefully. I believe there's been 6 reports across the U.S. of a rare clotting disorder where people have had a blood clot after receiving the vaccine. So that's the reason for the pause. But out of, I believe there's 12 million doses that have been given, 6 reported cases of blood clots. Again, nobody's going to take any chances. They're going to review everything, but it's all relative. Do side effects happen? Yes, they do. That's just part and parcel of everything we do. So vaccine update overall. Again, reminder, this is data from last Wednesday. Our dashboard will update with new information tomorrow. But 842,000 doses were issued across the county till last Wednesday. 708,000 were Tarrant County residents, out of which 21% of the county, 450,000 people have received at least one dose, and 12% of the county, 265,000 people have completed their series, which includes Johnson & Johnson. The maps indicate where we have good coverage and where there are areas that are lagging and need more attention. And I want to reassure you, there's a lot of people now paying attention to these maps and making concerted efforts on trying to drive vaccination into those areas. So I do expect improvements to occur over the next few weeks in those particular areas as well. Here's just the sign-up map. That's the main point, that there are still areas that are low on sign-up. So if anybody's doing sign-up efforts, we need to help in those particular areas that are lighter shaded, because people have not signed up from those areas, and it's one of those steps that we require that people at least express their interest. We can't go stick them in the arm if they're not interested. So we want to make sure that they sign up and get vaccinated. And then the final part here is the demographic slide. I want to continue to point out that every percentage point is now kind of hard to achieve because the numbers at the bottom are real big, but we are making progress on all aspects. Some of the data is going to remain unreported, like for example on ethnicity, there's a big gap on 44% not reported. It's just going to stay that way, but we're making progress on all race and ethnicities getting vaccinated. Again, underserved communities and minority communities, we need to continue to focus more on, because there are social barriers that, make people not, trust the vaccine or not sign up for the vaccine. They don't have time. They don't have other life issues happen. So we'll continue to make those concerted efforts to make sure that there's an equitable distribution of the vaccine. And then the final slide here is the data summary. Just kind of show you within the public health effort, not the entire county. It's just us, Arlington, and a few of our partners working together. We've given out almost 580,000 doses so far. And as of last night, there were only about 4,000 people left in the database. And those all kind of came up over the weekend when they were being called saying, this is your final opportunity, we already gave you an appointment, we didn't hear back. So some people did respond saying, I still need an appointment. But technically, we're done. Now, if there's rescheduling needing to be happened from this AT&T site, so this week will stay full and probably spill over into next week. But what that means is that people need to be able to go onto the website and sign up, because we're out of our waiting list, so there's not going to be a long wait. As of this morning, I had appointment capacity at all the clinics. We actually even created a drop-down feature where you can see which clinic has appointments available. So you can pick that clinic of your convenience, whether you want to go a certain spot. And then you also have the ability to pick a suggested time. That's not a guaranteed time, but at least it lets us know if suddenly 3,000 people all want to come at 9 a.m., we can message them saying, don't all come at 9 a.m. But it gives us an idea on how the traffic pattern throughout the day is going to be, so we can prepare and plan for that. But the main issue was that we now have the ability to give people the appointment of their choice, because they can pick a day that works and a clinic that works for them. It's a little bit more convenient.
Public health, and then there's a call-in number if they want to call in.
Correct.
And then that call-in number, they can talk with someone and say, I would like to go to this location.
Yes, sir.
And then the person on the line will assign them a time that is convenient for them, and then they can go, and it's usually going to be either the same day or within a day or so.
Yes, sir. And again, that was really true this morning till this whole Arlington thing. And so now we might get full by the time people actually start calling. But they have been calling yesterday. I mean, yesterday was a very full day for our call center because of this rollout and the availability. So we like that because we want people to get vaccinated. So let's keep those calls coming. And then if people are technically savvy enough to go on the website, it's tarrantcounty.com/COVID shot. They can do a self-service. They can book their own appointment, pick the day that they like. We're flexible enough that we will work you in all day. You can pick an hour block and come at that time at your convenience. But just so that you know, it's not a guaranteed appointment at that block. We kind of work people in throughout the day.
But it's tarrantcounty.com/COVID shot.
Yes, sir.
Okay, right quick, because I do know you have to go, Vinny, so now with the FEMA site being on hold, then we effectively have no mass vaccination presence in Southeast Tarrant County, which of course is concerning for me. I know that we're working on a site in Arlington with UNT, so just saying that it'll be really important, obviously, for us to make sure that that gets stood up, very timely. And then I wanted to make sure with our transportation agreement that now, since I want to make sure if for sure anyone from Southeast Tarrant County that's having to get outside of Southeast Tarrant County, that all those options are still available to them. I'm assuming that it would be, but I know obviously people can get an appointment anywhere, but now that we know for sure that people in Arlington or anywhere else in Southeast Tarrant County won't be going to the Arlington site just like others won't. I just want to make sure that we thought through that and that we won't have any additional access issues. So.
I will make a call and check in on that.
Okay, great. Okay.
Mr. Benish, you want to mention about the two other sites that are being called? Yes, sir.
What we're going to do, we're going to excuse Vinny now. He'll be in the building, so he may be coming back. And so while he's gone, y'all make sure you think of as many questions as you possibly can. So,
all right, thank you, Vinny.
And we'll talk more about some additional sites that we're going to be opening up.
Great.
Today. So, Your Honor, if we have two people that have asked to participate or filled out audience participation forms. One is a call-in and one is in person. If you'd like to do that at this time.
I'm going to start off with the call-in, Joanna Cardozo. I think I'm going to do this. It says resetting to the factory, so I tell you what, in the meantime, while it's resetting to the factory, I'm going to ask Robert Bucher to come forward. Initializing. Very good, son. Somebody from IT who knows how to operate this.
call phone may want to start coming up here. Morning, sir. You know the routine.
Yes, sir. Morning. How are y'all? Honestly, my speech kind of got derailed a little bit after listening to Benny talk. When we speak on the 1%, we get that from the CDC website. They say it's a 1% survival rate according to their site. But yeah, here we are lying. Now I have to go. We have to revert back to this. And to continue to listen to him lie is getting old. It's getting real old. We're going upticks. We're having all this. We're going to die. Death and gloom is what he's doing. I have a friend of mine who is deep into being a teacher, and she had sent me some very vital information. Let's see. Active cases 3, active quarantine 54, active cases 23, active quarantine 328. It's pretty low, but we won't talk about that. And let's talk about the mask since he wants to keep bringing it up. The masks are working. I'm steadily getting more KCAL and more Keller ISD emails saying, Corona, Corona, Corona case, Corona case, Corona case. I mean, if it's working, I shouldn't be getting 3 a day since last year. 3 a day, and it's working. It makes no sense. If it's really working, why is it not working? Why are the kids still getting it? Or like a better words, where's the flu at? Oh, we ain't seen that. That's been gone. I don't understand this. I don't get it. I don't understand it. And last week, or the week before last, when I listened to the guy from JPS talk about how he needs some more money for the bond, right? He forgot to tell you what I get to see on a day-to-day basis. Somebody has a little episode, goes to JPS, and maybe have a warrant, maybe not have a warrant. They stay there for 2 or 3 hours, kick them back out and send them to us. Not even regulated. Not regulated at all. Flying off the handle, coming in pissed off. But they want some more money for mental health, but they don't even treat them the right way. I see them day in and day out, and I feel sorry for them because some of them are indigent, and they just need help, and they don't know how to ask for it because they've got no other choice but to fly out because they're not regulated in their mental. So for him to ask for any more money, he needs to start asking why his staff is kicking him out after 2 or 3 hours, and if they have warrants or if they're violating any kind of law, they come to us flying off the handle. We don't have the medical facility where I work at to even help them.
1 minute.
So I mean, like, for him to even ask money is just absurd. I definitely would just look at saying, no, try something different. But to keep listening to Vinny after lie after lie is just, it's getting old. It's getting really old. I mean, at some point in time, you got to ask him the questions, hey, bro, what's really going on, man? Look on the website. It tells you that. It's got all of it laid out. Look on the DSHA site. It tells you. Do your own research. That's what they used to tell us back in the day. They said, teachers used to pound in their head, do your research, do your research, do your research. It used to frustrate me. But as I got older, I'm like, now I see why. And I thank those teachers that did that. But at some point in time, you've got to stop listening to this guy. You got to start asking the questions. Like, dude, come on. I'm looking at the DSHA site in real time. How are you 200 to 500 people over? Why? What are you getting out of this? I got to know. I got to know what is the end game to this. Because if they're working, Keller ISD would be sending me constant emails. My friends that are over there in Keller ISD
It's time.
Okay, thank y'all. Appreciate y'all.
Thank you. Obviously, I pushed the wrong button. But we're making an attempt to correct my error. And we'll see how this works. I think I'm going to hit that button right there. Maybe I'm going to hit that button. It takes our phone system a while to come up too. Our new phone system. Don't ask the question if you don't want to answer.
Just be very quiet.
Joanne, get ready. Notification.
Let's see if we can get
Well, I think we're there. We'll see. Joanne? Joanna?
Yes, sir.
This is Judge Whitley. We're at that time on the agenda for public comments. So you had indicated you wish to address the court, and now you have 3 minutes.
Okay, yes. My name is Joanna Cardoza. I live in Precinct 2. Before I talk about the vaccinations, I do want to ask my county commissioner to please put some fire on the people that are working on Nathan Lowe Road in Precinct 2. They're taking too long to look. I keep driving like in a road that seems like it's in a third world country. It's all dirt. But going into vaccinations, I want to talk about the good before I talk about the opportunities. I do appreciate the efforts in the community from my commissioner and the Arlington Fire Department at the shopping centers, centers of worship, working with community leaders, and also to the UNT Health and Science Center for engaging the community groups for valuable input on how to. In regards to the opportunities, I do believe that we need to be in the community to create awareness of upcoming events prior to the event. I have had the opportunity to be at a couple of registration events, and we had a lot of people that just show up, not aware that the event was even coming up. I know that the UNT Health and Science Center is going to be using one of these strategies to be in the community prior to an event. We also have a lot of people showing up thinking that they can get vaccines the same day. So if we can create more events like that in the future, I think that would be a good opportunity. Let me see. Also, I do appreciate the efforts from the Arlington Fire Department, but most of their events are only until 5 o'clock. Many people work in these communities. We need to have more evening events for people in the future to show up to get vaccinated in the community. I was at an event at St. Matthew Catholic Church, and we actually had to close the door at 5 o'clock because we were not allowed to let any more people in. And we had a lot of people show up at the door that we could no longer let into the vaccination site. We need more information in Spanish for our community. I have been fortunate enough to receive my first dose of the vaccine, but all the information that I have received from the Tarrant County Public Health via email, phone calls, or text has all been in English. So we need to work on that. Also, I've been struggling with my knee, which has kind of put me in a situation where I really have to think about when I go to a certain location. I did receive my vaccine at the Tarrant County Resource Tarrant County Resource Group Center. Long line. It was very, luckily my mom went with me one of the times that I went up there, and she went and stood in line while I waited for her at the front of the line. That's something that we definitely need to look at to make it easier for people to get the vaccine. Nobody made an effort to let me know that I could go to the front of the line or anything like that. Also, I do want to make a comment in regards to Constable T. Kane.
Okay, Joanna, your time is, your 3 minutes are up.
Okay, sir.
So if you would, we'll have to do the other at a later time.
Okay, thank you, sir.
Thank you. Have a good day.
Yeah.
That's the end of the audience participation that we have at this time. Mr. Manius, anything else on item number 1?
Yes, we do have one very brief presentation. So.
Good morning.
Good morning.
Good morning. So, get some stuff gathered here. We'll start with our pillar slide this morning, and just a quick note on this. So we'll continue to update this weekly, especially for the ERAP program and the eviction diversion program, as we hope that we continue to see these numbers increase every week. The CRF rental assistance program is almost complete with approximately $8 million paid and 2,407 total households assisted. I believe that they're only waiting on 2 applicants to reach back out to us before that program is done. So I think we've done everything on our end. We're just waiting on outside people to reach back out. And then this week, we're going to change it up a little bit and focus on the ERAP program specifically since it is new. And we're going to talk a little bit in more detail about that on a separate slide. And then just also a note on these pillars. So as the new ARPA funding and guidance come in, I would hope that we could start evaluating these pillars a little more and the various programs and maybe what the court wants to do with the money as that comes in as it relates to the 4 pillars.
I would say I talked with NACO exec last night. He indicated that NACO, in talking with Treasury and working with them on developing the regs, had submitted about 250 questions from counties across the country with regards to what kind of questions, flexibility, things along that lines. They're anticipating that it'll be the middle of May before the Treasury issues those initial regs, and that it will be also the middle of May before they issue any forms that would be necessary to indicate your willingness to accept the money. So I would suspect that it'll be around the end of May before those funds come in, but I think we need to continue to monitor, and I know that y'all are participating on those phone calls, so I appreciate that very much.
I know Vinny was up here earlier and he talked a little bit about vaccination efforts updates, so I'll skip over that. But just a quick note for JPS, they have administered 75,011 doses. That's between first and second doses. Testing site closures are not on the vaccination update slide this week, but the Azle testing site location will shut down this afternoon, which will leave us with 3 permanent testing sites at NRH2O, JP Elder, and TCC Southeast Campus. These should remain open after April. However, the testing numbers are continuing to drop. I think there were only 8 at JP Elder yesterday. So we'll evaluate those numbers weekly and kind of see where they stand and keep you all updated.
So pretty much if you need a vaccine, go in and not a vaccine.
A test.
If you need a test, you go in and you can be tested immediately. And
pretty much. I mean, the numbers are low right now.
So one of the things on this slide, and it answers, or partially answers the question, Commissioner Allen, you raised, UNT is going to be opening 2 sites, one at the Ridgemar Mall in Fort Worth. UNT will be here next week, but the second one will be at the Cornerstone Church in Arlington. We're anticipating that, and I believe that they've been working with you on that location. Because of what the city of Arlington, their efforts and everything, and they're going to step back a little bit. We're trying to get more sites open to that part of the county also.
But this is vaccines, not tests.
Yeah.
These are vaccines, yes.
Yeah.
And then another quick note on UNT. Their marketing campaign did launch, and so that includes print, billboards, flyers, radio, direct mail, digital display, paid social, and streaming radio. And their newest undertaking includes the distributing information at gas station pumps and convenience stores. They will be here next week to talk more about those 2 new sites that Mr. Manius just mentioned. The one at Ridgemar Mall, I believe, is going to be in the H&M Shopping Center. And then, as Commissioner Allen had talked about earlier, I think it's Cornerstone Church in Arlington. Also, another UNT note is that they're going to begin taking direct appointments at the Saginaw and the Stop 6 vaccination locations, and that'll be through their OptumServe website, which you should start seeing on billboards and some of their other informational flyers that are being put out. And then Vinny talked a little bit earlier about the direct appointments for our website. So unless y'all have any questions on that, I'm going to skip over that material. But we will utilize the call center, and Group O Agency is helping to assist in the registering and booking of appointments for anyone that calls in. And then a quick transportation update for the JPS sites. So Kristen did work alongside other staff, and she was successful in getting all 6 JPS vaccine sites added to the transportation program, and that is up and running this week. Okay. Okay, so as I said earlier, we're going to dive a little bit into this ERAP program since it did recently launch, and we just wanted to give you a bit more in-depth detail on how that program is going and some background information. So moving forward, you all will receive the application and payment information in the weekly report that Redmond sends out. And then as you all may have heard, the Texas Rent Relief or TFF program through the state has experienced some major delays in reviewing and approving applications for payment. So staff running the Tarrant County program have heard from several Tarrant County residents and renters who applied to this program that they still have received no word about their application from TRR. And so we're working with those individuals to withdraw their application from the state program and apply to our program so that we can help them in a timely manner. We currently have a total of 557 applications with 394 in progress and 36 that have been approved. We did have 61 who were ineligible, but that is because they were either above the income threshold or they were outside of Tarrant County. If they were Arlington or Fort Worth, those were sent to the appropriate contact persons for those programs. And the first payment file was sent to the auditor's office on April the 8th. We anticipate that being sent out next week following court approval. And moving forward, we're going to strive to make sure that that turnaround time is hopefully between 4 to 5 weeks. And that's from the time we receive the application to funding being sent out to the tenant, renter. Okay. Any questions on this? If not, the next few slides are just visual aids. You might notice the data varies a little bit, but that's just because it's based off of how far the applicant has made it in the program. So the first chart is by property location, which as you can see, or maybe not see because that's super small. Precinct 3 has the highest, with Haltom City, Hearst, and Euless being the top 3. And then the next is just the AMI, which shows that the majority of applicants are at or below the 30% threshold.
And then, of course, because Arlington and Fort Worth receive their own allocation, that's why they're not on this.
Yes.
Okay.
That's correct. This is just the urban county piece.
And then the last two are just demographic information. And if you have any questions on these, I'll be happy to answer. You can see that the race is pretty equal over there, split between African American and white. And then the ethnicity is the non-Hispanic or Latino.
So I might be fixing to ask a question that you've already answered because I was looking at some of the vaccine stuff. But again, this is the portal where people can go to one portal, they define where they live, and then it sends them to whichever particular entity they need to go to. So if they entered the portal and said they lived in Arlington, it would feed them to Arlington. If it was Fort Worth, it would feed them to Fort Worth. And otherwise, it'll feed them to the county for rental assistance.
Kristen, yes, yes. She's shaking her head, yes.
Got RentHelp.com, or get
yes,
RentHelp.com.
Okay.
Okay.
Before you move on, I don't have a question, but I forgot to give this announcement that I will be hosting an emergency rental assistance program town hall next Wednesday from 6 to 7 p.m. on Facebook Live. Kristen will be joining me as well as some other speakers to kind of talk about this this emergency rental assistance program. So,
and then also, if there is some specific data that you would like to see for this program pulled out, email Kristen or myself, and we'll make sure we get that pulled out for you individually or as a group, or if you want it up here, we'll do that as well. Next is the vaccination call center. So after comparing some of the data for the last 3 weeks for the charts, we did notice that 3 new zip codes popped up this week. So 76179, 76108, and 76131 are all new. And I don't know if it does coincide with the opening of the vaccination site in partnership with UNT out at the Saginaw Recreation Center, but these did all pop up as new zip codes for this last data week.
The call hotline for registration for questions
Yes,
for all that, is the number on that the 817-248-6299?
I believe
so. That is the
so.
number.
Mm-hmm.
Okay.
Sir. And then I wanted to check with you all. Would you like to continue to see this in the weekly presentation, or would you like this to be just a handout to you all? Kind of want to leave that up to you. Okay.
You probably guessed that.
And the last couple of slides are a grant update and spend update. You'll notice on the grant update slide, we did add the $2.5 million. That's the very last line down on the bottom, that's for the UNT Health Science Center contract. And then on the county spend update, you'll notice that the total amount has increased. I think last week it was 300 and some odd thousand. We're back up to 22 million. And that is because we ended up moving the UNT Health Science Center contract over to the FEMA eligible expenses, and we do anticipate the majority of those costs will be covered under FEMA reimbursement. Any questions on that? If not, that's all that I have for today.
Thank you, Monica.
Thank you.
So, members of court, we're going to move around on the agenda again and go to another briefing item. This concerns an update from JPS concerning the bond package and also other activities at JPS. Mr. Early is here to address the court at this time. Also, members of court, I sent out a copy of the program management agreement to you all yesterday. If you all have if you were unable to open that file, let me know. We'll make sure we get you a hard copy of that. We're not asking that you take any action on this today. We expect to bring this to court within several weeks for your final action.
Mr. Manius, thank you, Your Honor. Commissioners, thank you, Commissioner Johnson. It's good to see you, and it's good to see you all here. I'm just, without belaboring things, I would give you a little micro look at JPS and how we're dealing with the vaccines and give you an idea as I update you all weekly on where we are with vaccines, update you daily on where we are with vaccines, but update you where our patients are. We continue to see lower numbers than we previously had of hospitalized COVID patients. But to those that are listening, live streaming, or others, COVID is a challenge in that it's hard to pick one day or 1 week and decide that's where it is. COVID moves constantly. And I think those of us in the healthcare field that have witnessed the devastation of COVID, you're pensive and you're constantly pensive. You're never constantly sitting back going, great, victory is ours, COVID is over, because none of us feel that way. So we are pleased by the fact that we have 16 hospitalized COVID patients today. And that certainly is contrasted to the fact that we had highs in the 200s at one point. So it is something that we are appreciative of. It is not something that we are sitting back thinking, life is wonderful and it's all great. I want to applaud JPS and I want to applaud you all as a court, and I want to applaud public health, and that I think this community has dealt with COVID in the most methodical and pragmatic way as possible. I don't think we've run out in the streets and set our hair is on fire, and I don't think that we've been complacent at any point. I think we've reached out to communities that have low numbers of vaccinations. We've reached out to those same communities that had high numbers of COVID, and we've attempted to address that. It is the proverbial getting a horse to drink at the pond at some of this, and trying to get people to take their vaccines and try to wear masks. So I'm not going to shy away from hoping that everybody in this room has had a vaccination. And if they haven't, I will do my best to encourage them to do that. I still believe in social distancing. I still believe in a mask. For those that don't believe in that, I cinch my mask up tighter, because I think that is the approach to take. And I will continue to do that because I've got 600 medical experts telling me that's a smart thing to do. In regards to the vaccines, Vinny gave you the numbers countywide. To give you the micro of that from JPS, we've provided 75,000 vaccines at this point, a little over 75,000 vaccines. And the reason that I think that number is good is because we're still an operating and running hospital. We still have people coming into clinics because their back hurts, or we still have trauma patients coming in and heart attacks and strokes. So we're still running a hospital, we're still running all of our clinics, and we're still able to give 75,000 vaccines out since we started the vaccination process. So I'm proud of the team at JPS and proud of what we've done. I will say in all honesty and factually, we've begun to see a decline. We, at our peak, would probably deal with about 1,200 vaccines a day at the clinic level and at our main campus level. Yesterday, our numbers, we got 615 people vaccinated. Today, we're scheduled for 490. Those are the people that have accepted the invitation to come in. So I want to be very upfront with you all in the community to let you know that those numbers are declining for people signing up, but at the same time, we are being as aggressive, if not more aggressive, to try to get people in to get their vaccinations. So to that point, should JPS have any additional vaccinations, and we are looking at that possibility, we're working with Vinny in public health, we're working with the FQHC, we're working with anybody that we feel is a viable opportunity to get vaccines to. It would be my hope, and again, I'm just the CEO of a hospital, my hope would be that everybody has a vaccine, and that we would do that. And I will do my best to continue to take that stance. In regards to Mr. Manius' comments about the Broadus-Levis contract, I will continue as I gave you the briefing 3 weeks ago about that issue and where we were with that program. I will say that our team at JPS and the Broadus-Levis team have worked exceptionally well. And the contract that is before you has been one that's amicable and been worked out with those two parties. Now, to Mr. Manius' point, we had the biggest degree of problems, and Commissioner Johnson will appreciate this, knowing his IT expertise. We had a real challenge getting that 152-page document. Thank you for smiling, Commissioner. We had a real challenge getting that 152-page document to Mr. Manius. Our board voted on that on Thursday. Thursday at 4 o'clock when the meeting was over, we immediately began to get it to Mr. Manius' office. At Friday at noon, we still hadn't gotten it. So I quickly ran to the farm, got a Clydesdale, and put the paperwork on its back and took it to Mr. Manius' office. And so he got it. The reason that you all got it later is I went and let the Clydesdale go home and eat, and it didn't get the paperwork to y'all. So it took us a little bit of time to get the document to y'all. But to that point, I have two incredible people here. If people think that in any way I do a good job, it's because I get to work with people like Adam Lane and Angie Morgan. Adam Lane joined us. I introduced him to y'all before. But Adam Lane is our Chief Facilities Management Officer. And he was actually doing a stint in Kansas when we found him, but he actually worked with most of the major health systems in Houston. And we picked him up, and he has been a huge asset to our team. But then you have a person like Angie Morgan, who's been at JPS for an incredible amount of gifted time that she's given us. And Angie is our Executive Director of Construction and Facilities. And when you look at Angie Morgan, you see an incredibly kind and wonderful woman. When you negotiate with Angie, she is really difficult. She is not a person to cross. So you look at her right now, and she's all pleasant and nice. Don't negotiate with her unless you want to be on the short end of the stick. She's good, and so is Adam. The reason that I introduced them to you is they're available to you and they're available to your staffs. Should you all read through that document, or your staff, or you want the video version of it, or you want the movie version of it, we'll be happy to get you whatever you want. But whatever questions y'all have, those two individuals are the ones that not only negotiated the contract, they worked on every period, every comma, and every aspects of that contract. And they are available to you and to your staffs. But to Mr. Manius' point, please, in his case, don't shoot the messenger. That file, that 152-page file, just seemed to be cantankerous to get down here, and that's why it got to y'all individually a little bit later.
By the way, that Clydesdale was filed a workers' comp claim.
I want to know, what was the Clydesdale's name?
Fergus.
I knew it was going to be Fergus.
It was Fergus.
Fergus was his first one. That's his baby. He wouldn't sell that horse
That's true.
for any amount of money.
But
That's Budweiser.
I can't go without being on a microphone or being before y'all and complimenting you as a county. I've dealt with other counties. I will say that what JPS has done through COVID, working with state officials, you all, public health, working with local officials, working with federal officials, our communication has been really strong and good, and I would not miss a beat to compliment the people at JPS. It is challenging, and it's challenging to lose life in front of you by a virus that you still don't have all the answers to. It is serious. It is truly not political. It's serious, and it's a challenge, and we cope with it every day. And I couldn't be more proud of 7,200 folks that have had COVID and come back to work, and doctors that go in and deal with people wearing equipment that you and I have never had on, and air vacs in the back just to keep them cool enough to be able to stand all day long and deal with those patients. So I'm never going to miss a beat to compliment the incredible team and the other healthcare providers. And my colleagues in the industry have done some amazing work. So thank you, commissioners. Thank you, Judge. Thank you, Commissioner Johnson. If you all have any questions, I'm happy to attempt to answer them.
I do have a question about the JPS locations where the vaccine is being distributed. I don't know if I've seen a list of that recently, so I can't remember. What are those 6 locations? And then maybe even for Kristen, these are the 6 locations that have been added to the transportation program. So can I just get a copy of that list to make sure I know for sure which locations?
Absolutely. It's also posted at the bottom of the list on our tarrantcounty.com/vaccine rights.
Very good. Okay. Okay, great.
Thank you, Kristen. Yes, ma'am. We'll make sure that you see that and get that. Thank you. Thank you all very, very much. I appreciate y'all more than you know. Mr. Manius, thank you. And Fergus, we'll talk to you later.
I would say, not of you, you're free. Go. Since Vinny had been up there, and I see Vinny is back, so I'm going to ask you to come back up here just to give us a report. But I looked at not only the public health website for COVID shot, also I know that UNT has their, I believe it's My Optum website that you can also go on, optumserve.com, that you can go on and register via the computer. Again, I want to emphasize that if you want to just call in and talk with somebody to make your reservation, that's 817-248-6299. And you can call in, tell them where you want to go and approximately what time, and they should be able to set you up an appointment. Either probably, and more likely than not, maybe not that day, but within the next day or so. And again, as Vinny mentioned earlier, there may be some exceptions to that because of the J&J being put on hold. And I'm going to ask you just got off the phone call, so talk with us a little bit about what was said about the Johnson & Johnson and status on that.
Yes, sir. So again, it was kind of a level set meeting between FEMA, our DSHS, City of Arlington Fire Department, sort of everybody's on the same page on what is happening. Again, what we heard this morning, there were reports of 6 blood clot related issues across the country out of 12 million doses administered. So FDA is taking just a momentary pause to review safety data to make sure we're not missing anything. Similar situations overseas, so they expect this to be resolved. But till it's resolved, everybody's supposed to hold. And what we heard from Arlington with all the logistics that go behind operating a site is that if it doesn't get resolved in favor of using J&J, currently the plan is to not resume that large mass clinic operation, and then we'll absorb those clients back into our operation. So that's kind of where we are. It's still tentative. They're going to give it a day or two to see if there's a lift, from the FDA saying no, we're okay to resume. The FEMA folks and the DoD folks are here till the 20th. I think the last day of operation was 19th. So if FDA lifts their pause, Arlington and FEMA and DoD will all resume the J&J operation at AT&T Stadium for the remainder of the term. So that's where we are.
So if it's not, they don't lift the pause, then is FEMA going to go home after
that is currently
next Tuesday?
Yes, sir. That is currently the plan, and we will continue to on a daily basis invite people back into our clinics, other clinics that are doing Moderna and Pfizer, because they have their appointments currently set at AT&T Stadium. We're going to send out a cancellation notice and then follow up with a rescheduled appointment.
So if someone was scheduled for today and they show up at AT&T Stadium, is there going to be anybody home?
Yes, so they have the Arlington team there. Their plan today was to continue to do Pfizer second doses, because that has happened. People have missed their second dose appointment. I believe they have, a few thousand on hand that they continue to plan on doing those Pfizer second doses. And we will touch base with them again. If the volume isn't there, they might not want to have that operation at the AT&T Stadium tomorrow. They have a Arlington medical pod unit, a different address. So we
Is this their public health?
Yes, sir. Their public health unit. They just reopened a new building. So they might take a few Pfizer folks there, but it's kind of in flux right now with all of this, because all of the operational people were at AT&T. But if the volume doesn't show up, then it doesn't make sense to have, 200
Well,
people.
and I understand that, but I want to be sure that we don't mislead people to think we've closed down AT&T now. Until further notice, AT&T is still open.
Correct.
For second shot Pfizer, which is what the FEMA folks did the first 3 weeks that they were
Yes,
here
sir.
with the extra
Yes.
vaccines. So unless we hear otherwise, if you were scheduled to go for a second shot at AT&T Stadium, you should go, and if that changes, you will get an email
And
and a text
message and a phone call. Yes, sir.
and how long and how much before you were scheduled to go will that come?
Probably rolling on a daily basis. So, because again, we don't want to cancel too far out, not knowing when the pause will be lifted. So today's messages have already gone out. People have received their cancellation notices. The team is looking at absorbing them within our schedule for this week.
Okay,
so
so wait a
hopefully
minute.
by this afternoon, we'll
If
send them rescheduled
when you
appointments.
say the cancellation notices went out today,
Yes, sir.
what did we cancel?
Their appointment at AT&T Stadium
For what day?
for today. Because
So you're telling me that the day of,
For Johnson
we
and
canceled?
Johnson.
yes, sir. Because
For Johnson & Johnson or for?
for
second?
Johnson and Johnson. Yes, sir. Yes, sir.
Okay,
Yeah. Sorry.
let's back up.
If I wasn't being clear.
Yes.
sir. Yes, sir.
Johnson & Johnson, if you were scheduled to get a Johnson & Johnson, forget about it right now.
Correct. Yes.
But if you were scheduled to go to AT&T Stadium for the second shot,
Pfizer, that is not canceled.
You
correct.
need to go.
Still need to go. Yes, sir.
and are we notifying the people who are coming for the second shots? Have they got appointments, and is it, so we've texted them, we've phoned them, we've emailed them that says your second shot is going to be at AT&T Stadium on Wednesday, April the,
So let me clarify. These folks don't have a scheduled appointment for their second shot at AT&T. These are people that were left over. They were called for their second shot. Either they didn't get it or they missed it. So AT&T has been doing walk in. So they're not scheduled for their second shot at AT&T Stadium. They have capacity to do any people that were left out. So that's what's happening. So there's not a call out saying, okay, your Pfizer appointment is due at AT&T Stadium, go there. That's why it's a little unclear. All of the people that we had scheduled for today were actually Johnson & Johnson people.
okay. So I
And
want
we
to
canceled
clarify a
that. Yes,
little
sir.
bit more and go
Yes.
through this one more time,
Yes,
because I'm
sir.
a little simple about this.
Yes, sir.
If you got your original shot, your first Pfizer shot from Arlington,
Correct.
and you're due your second one and you missed whatever date you were supposed to go, you can go to AT&T Stadium today, tomorrow, at least at this point in time, for at least till the end of this week, or you can go until next Monday, the 19th.
So
Unless we cancel it, or unless they cancel it somewhere between now and Monday. But right now, if you were due a second shot, you can just, and you were due it from Arlington, then you can go to AT&T Stadium and get that second shot sometime between now and Monday, unless we notify the public before then that that's done. After Monday, FEMA's done with the Pfizer shots. And so if they go past next Monday, they better be looking for someplace else to get the Pfizer shot, second shot.
I know for sure that today they're there to do the Pfizer second shots. given that the large operation, it may not be there tomorrow. I don't know that they'll be there. They might say, let's shift these folks to the public health unit in Arlington. So let me continue to work with Arlington, and we'll try to have them message out, because they've been putting it out on social media on where to go and all those types of things.
And I'm fine with that, but let's give people at least a day's notice.
Understood, yeah.
Let's not get up Wednesday morning and decide we're not gonna do it Wednesday. If we're not gonna do it starting Thursday, let's announce it tomorrow, ask these folks to get it out on everything they can get it out on, send emails, send text messages, do whatever. Well, let's not wake up the same day and decide we're not gonna do it,
Yes.
okay?
So how much lead time will we get if they will begin to utilize the J&J again?
We don't know. And again, this is all dependent on FDA and their communication.
I understand that. So the timing has to be, we don't want to send a message out that we canceled and all at once J&J is available that day. So we have to just get it.
I mean, I hear what you're saying, but we've got to be very distinct between the Pfizer second shot, which is what we're talking about right now. Right now, Johnson & Johnson is on hold until we hear and we tell people otherwise.
Pfizer second shots don't have a scheduled appointment at AT&T.
I understand that.
So they're kind of walk-in as they need.
I understand
So it's kind of
that.
hard to communicate with those folks because we don't know who, you know.
I understand all of that. What I'm just saying is if Arlington decides for some reason or another that they're no longer going to give second shots, give us at least 24 hours notice so that we can tell everybody, if you were planning on going to AT&T Stadium,
go to a different site.
Go to a different site.
Agreed.
As far as Johnson & Johnson goes, until further notice, they need to plan on not getting the Johnson & Johnson. If in the meantime, they can go someplace, and they can call or they can go online and set up and register for the Moderna or for the Pfizer, and they can probably get in within a day or so, then I would suggest that they consider doing that. But at least from now until we do a lot of publicity saying Johnson & Johnson is back up, Johnson & Johnson just is off the table.
Yes.
So does Arlington, we gave the names through files to Arlington. Once we do that, does Arlington communicate directly with these individuals, or do they want public health to do that?
So we are making the notice invites on behalf of Arlington because they're coming off of our registry.
What about the updates? Does Arlington communicate any with that, or are they anticipating public health to do that?
About the updates related to cancellation of Johnson & Johnson? We did that on their behalf.
Okay.
Yes, sir.
Okay.
Yes, sir.
So you're working with Arlington?
Yes, sir, we are. And I hear what you're saying, so I will communicate that with Arlington, that if they don't plan to operate and stay open for second doses also, or have a shift in location, we need to know so we can, publicize.
And we would like for them to give us at least
Yeah.
24 hours notice so we can just blanket the news and the media and emails and text messages and phone calls.
Yes, sir.
But for as far as Johnson & Johnson goes, right now, if anybody thought they were getting Johnson & Johnson, they're not.
Correct.
Until such time as the FDA says that we are cleared to give that. Now, and in the meantime, if those individuals want to get on the list for Moderna or Pfizer, they can go to our website and re-register.
No, they don't
Okay,
have to re-register.
then forget
Yes,
that.
sir.
Go straight to the call and say, we want an appointment. We've already registered, we want an appointment.
Yes. So let me clarify that process also. People that we already know, like for example today, we know that we sent them cancellations. Your appointment is canceled at AT&T Stadium because of the Johnson & Johnson issue. We're already calling them with a revised appointment saying, this week we have capacity at this clinic, your appointment has been rescheduled. So they have the option to come or not come, or call saying, no, that time doesn't work and give me a different time. We've already had conversations about this impact spilling over into next week. So we're prepared for all of that. It's going to be a little fluid because, again, suddenly we had pushed all of this volume over there. Now we're going to reabsorb it within our clinics. But we will work with the folks, get them a convenient appointment. One other
Most
thing.
of your pharmacies are gonna be out of business right now because most of the pharmacies in Tarrant County had been given the Johnson & Johnson vaccines.
Well, some have Moderna and Pfizer too, but yes, I mean, there's a lot of Johnson & Johnson at the pharmacies as well, yes, sir. So one other thing, Your Honor, I wanted to clarify, you mentioned about the call center receiving calls to book appointments. Currently, they're trained to book appointments on our website, tarrantcounty.com/COVID-shot. They are not trained to book appointments on the Optum website because I think it just went live yesterday. And their process is a little different. I think they have their own call number. So we will clarify that with them and
If they
figure that
call
out.
in.
Yes, sir.
I'm assuming that our folks will know where to go to register them, and they'll take care of that process.
They will register on our website, yes.
If they go using the computer, then they can use the computer at either tarrantcounty.com/COVID-shot.
Yes, sir.
Or they can go to myoptumserve.com for the UNT registration. But if they go via the phone, they're gonna be registered with us.
With us, yes, sir. And to make matters more complicated, there's a state registry starting on April 1st. So there's a lot of things happening that we just need to continue to work through.
Y'all have clarified this to the point where it's about as clear as mud.
I know, I agree.
Well, and I'm getting ready to ask another clarifying question. Well, really, it's to voice a concern about our losing staffing and logistics capacity with the loss of the FEMA site. So was there, in this call that you just had, was there any conversation about evaluating other locations?
Not at this point, no, ma'am.
Okay.
I think Mr. Manius may have mentioned, but you were aware that there's a conversation with UNT about possibly putting a site over in Arlington.
Right.
So that is still, I think the goal is next week. Yes, sir, next week. Yes.
Yeah.
And you mentioned Ridgemar Mall. Is Ridgemar Mall, when is that open?
I believe next week, was it Monday, the 19th? I don't have a date in my,
It's going to be open soon.
next week at some point.
They're finalizing all the arrangements, but it's my understanding that by the time we report next week, that it should be open.
And that will be, is that gonna be a drive-through as well as a walk-in?
I believe it's a walk-in. It's inside at the, inside the building. H&M, I think, has an empty building in there.
That's
Okay.
what Megan shared. Okay, that's all I had.
Thank you.
Vinny, if somebody goes out of the country to an approved country like Mexico,
Yes, sir.
what's the procedure to come back? Can you explain that?
Currently, there's no requirement to quarantine. But again, if you believe you've been exposed during your travels,
I thought there was a test. COVID test.
Well, you can take a COVID test, but it's not a requirement. Those restrictions were lifted a while back. The governor had some restrictions about out-of-state and out-of-country travel. You were supposed to quarantine, but that was lifted a long time ago.
It's not an airline requirement.
Not a requirement anymore. It's recommended that if you come back, you take a test, you still stay home isolated for 14 days because you just traveled, but, it's not required. But if you've had an exposure, because people do know sometimes, I went there and there was a bunch of people and I think somebody was sick. Well, then let's work with you, stay home, let's observe what happens. That hasn't changed.
Okay. You might check on it.
I will. I will.
I thought there was
respectfully
a,
request that you check CDC guidance because my staff has, there's been individuals in Mexico that have to be tested prior to coming back to the United States, and they have to be tested once they are back in the United States prior to coming back to work.
Okay. I will check on that because they launched a new travel-related website because there's so many different guidance and restrictions where you go. So there's actually a CDC website, a travel checker. Depending on where you're coming to, they kind of put the restrictions on for that location, depending on state and local guidance. So I will double check that. Thank you. All right, thank you.
Thank you, Vinny.
okay, Ms. Glenn.
Move to receive and file personnel agenda.
Second?
We have a motion to second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning.
Morning.
We have a few more items for the court. Second item, we're asking the court to approve a waiver terminal benefits for CCC 8. County Criminal Court 8, Judge Vanover is requesting a waiver of 360 vacation hours, the details of which are outlined in your communique. We're estimating the net cost to the general fund to be almost $12,000. That does include fringe benefits.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Our next item, we're asking the court to approve a TO change for information and technology. Mr. Ifor is requesting the addition of a senior project manager effective April 17th. This individual, once hired, will manage all of the complex IGES projects. We're estimating a fiscal impact to the general fund of a little bit more than $155,000 a year. That does include fringe benefits.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And our last item will be handled by Ms. Duckworth.
Good morning.
Hi,
Morning.
how are you?
Hello. Okay, we're seeking court approval for 2 updates related to our flexible spending accounts. The first is approval of 100% carryover for all unused 2020 health and dependent care flexible spending accounts. And that is to plan year 2021. You may recall that you approved back in December an increase in the amount of carryover for the health flexible spending accounts from $500 to $550. On March 24th, the PBC Board of Governors met and approved the unlimited carryover for both health and dependent care flexible spending account funds from 2020 to 2021. This carryover will include all unused funds in those accounts regardless if they're employee contributions or employer contributions. Previously, the carryover for unused funds had not been allowed by the IRS for the dependent care flex accounts. And the dependent care flex accounts are for those child care expenses like daycare. And then the second update for which we're seeking approval is the allowance of those dependent care FSA participants that had a child that aged out during the pandemic to continue to receive reimbursements for child care expenses for plan year 2021. This update is specifically for those participating in the dependent care FSA that had a child turn 13 on or after March 1st of 2020. This would allow the employee to continue to receive reimbursements for child care expenses for the remainder of 2021 until the child's 14th birthday. There is no change to the run-out period. Just a reminder that that period is through the end of April 30th. And that allows you to submit claims for reimbursement of 2020 expenses for both health and dependent care flex. Although there's no requirement for additional funds, there is a financial impact to the county, which would be the absence of the receipt of FSA forfeiture funds. And just as a reminder, those forfeiture funds do help support the wellness program.
And how much do you have in that reserve right now? 1.2 million?
Yeah, approximately. Approximately 1.2
So I don't
million.
think our wellness program is going to suffer if we don't end up getting any forfeitures for 2020.
Can we assume that all that you described is legal under the various federal codes?
Yes, sir.
Move for approval?
Second.
We have a motion and a second. Any discussion? Again, this is only relating to expenses for 2020, and we're not dealing with anything as far as carrying over 2021 at this time.
Correct.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Benny?
First of all, I was getting a lot of clarifications. So there is a pre-boarding test requirement, especially if you're coming back from overseas. And I believe that was there for domestic travel also. A lot of airlines were requiring that if you're going to get on a plane that you must get a test up to 3 days ahead of time. But what I was understanding from your question, Commissioner Pickus, was what do you do when you come back? Right? Because that has had happened, you know, we've had to quarantine people as they traveled from overseas and coming back to work and so forth. But that's what I was trying to clarify, that those requirements have been lifted. There's no quarantine requirement per se about, you know, unless you're exposed, we're not automatically quarantined just because.
There's no 3-day test requirement for a negative test?
So that is before you board a plane, I believe. You know, and I'll continue to get clarification, but I believe it's before boarding a plane.
Home.
Yes, coming home from overseas, that is correct.
I understand there's two lines. There's $25 for the test and there's $50 for the negative test.
Commissioner Fickus, are you asking about Mexico? Was your question about Mexico?
Yeah, primarily.
And I will send you the info.
Bill Hanna just came.
I got a text from.
Yes, sir.
We'll get Bill Hanna to talk. He just came back from vacation from Mexico, so he'll be able to tell you.
Yes, and I've heard a lot of people, as I sat down, I came back from so-and-so, and I was asked to, you know, take a test before I, you know, enter the country. There's a Department of State requirement. So I'll gather everything and send it to your office. That way people can distribute as needed. All right, sorry about this. So Public Health has 3 items for your consideration. One of them is the approval of a educational affiliation agreement with Tarrant County and the Tarrant County College of Nursing with their Department of Nursing for student internships and clinical experiences with the Tarrant County Public Health. We typically do these with a lot of universities and colleges. In this particular one, we're excited that they actually want to help out at our COVID vaccine sites and bring their students. So again, this is a no-money agreement and we're requesting your approval.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Second item is a request for approval to submit a grant application to the Department of Health and Human Services to assist in advancing health literacy to enhance equitable community responses to COVID-19. I believe this is a $4 million grant approximately.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. And the third item is the request for approval of a subaward agreement between Tarrant County, doing business as Tarrant County Public Health, and the University of North Texas Health Science Center at Fort Worth to collaborate and promote knowledge to action in COVID-19 prevention and engagement. I believe this is a $44,000 subaward to them.
Move approval.
Second.
We have a motion and a second. Discussion.
Okay, so how does this fit into everything else that we're doing with you and two? And I did read the
my question,
attachment. Yeah.
So this is an existing grant. It's been separate. There's been kind of ongoing work, and this is a subaward for the amount related to promoting community knowledge. Different grants come with similar looking themes. So the one before this that we just talked about, again, it's a health literacy related. This one has components built in, and there's a third grant that we're getting from the CDC that has testing, literacy, vaccine hesitation, all of that. So they're all they work together.
So I guess my question is,
yes,
you're telling me then that the $44,000 is coming from the Fed, it's not coming from the county?
This one, I'd have to look at.
We spent $25 million, and if they're asking us for another $44,000.
Yeah, this is a different grant. It's not coming from the county. It's a grant-funded operation that we're separately working with them on. Not part of that $25 million. Yes, sir.
Okay.
Yes.
Okay, I'm good.
Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Melissa? I see you've kind of worked yourself back into Jack's seat now. Feeling a little bit more confident, got those feet on the ground, ready to go.
Yeah, much better. Well, good morning.
Good morning.
We have 2 items for your consideration. The first item is an award recommendation for bid number 2021-06061. This is our annual contract for prisoner extradition services for the Sheriff's Office and Juvenile Services, awarding to U.S. Corrections per unit price.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote.
I'm sorry, and we're also requesting contract approval.
Same motion.
Same second.
Okay. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the second and last item is regarding bid number 2021-006. This is the one we are bringing back to you from last week. It's our annual contract for inmate hygiene supplies. We're requesting cancellation of the primary award to ICS jail supplies for item 34 and cancel the primary award to Tab Textiles for items 1 and 6 and the alternate for items 2 and 29. These items are to be awarded to the next low bidders meeting specifications. ICS withdrew their bid because of mistake in the pricing, and Tab withdrew because of rising textile costs.
Are they suffering any penalty for that?
No, not at this time. These are good vendors. It's just the way the economy is right now.
Move approval.
Second.
We have a motion and a second. I do want, so the next time we do this and somebody comes in and we do ding them, are we going to say, well, you weren't a good vendor and therefore we're going to ding you and we didn't ding the ones that we consider good
Well,
vendors?
no, in this particular case, they did show proof of the rising costs in textiles.
Prior to or subsequent to the time they gave the bid?
It was shortly after the bid was awarded.
So we can document, and I would like for there to be documentation.
Yes, they had documentation from the manufacturer of the product that they were selling, and we can't substitute it in, so we did allow for them to withdraw and just award it to the next low bidders.
Well, and that's what I'm saying. So I just want us to keep documentation so that the next time we do this and we penalize somebody and they stand up and say, what happened? We can show documentation that indicates that the price increase occurred subsequent to. And I guess the only question that I would ask is, so we went to the next low bidder, which was obviously higher. Were they bidding the same product? It just, somewhere in here, I don't know. I just got, you bid it,
I would say they're bidding the same product. It's just that they allowed for, most vendors do factor in the cost for this contract to last 2 years, knowing that there could be a change in pricing due to most of this product comes from overseas. And I believe that this particular vendor just didn't factor that into these items.
You're not necessarily giving me anything that makes me feel better about what we're doing. I'm okay, but I just think we need to be consistent one way or another.
Okay, well, we can.
And I'm not saying I just want to penalize them, but historically, we would penalize somebody who withdrew a bid after we had awarded it.
So, Judge, I think I understand what you're requesting, and we'll get with purchasing and structure that the way we're talking here.
Okay. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Mr. Skinner?
going to do item 1 for transportation. Actually, it'll be a tag team with Randy and myself. Members of court, when we get to the transportation section where we're at now, we have an item on the agenda as it relates to the engagement of consulting services for the 21 transportation bond package. You might recall for the last 3 weeks or so, we brought you a request, and there was some discussion amongst the court about the need to, or the desire of maybe having more than one particular consultant that would assist us on this. And we've also had conversations with Mr. Vandergrift, who is the chair of the committee itself. And what we're doing today is we're seeking direction from the court. We don't have a recommendation to make to you today as far as any particular vendor or pair of vendors, just a couple of statements. I believe that if the court desires to have more than one consultant, that we can factor that in, and we can make that work. As we move forward, though, there's been some comments from some court members about the utilization of other individuals or groups such as RTC and the staff at COG. And what I would suggest that we do, we need to move fairly quickly, but I would request that you allow us to take this particular issue, staff meet with Mr. Vandergrift to formulate a recommendation to come to court. We'll seek your input on it, but then we'll make a final recommendation within the next 2 weeks, possibly the next week or so. I know we may not have a full court next week, so this is going to be something that I would like to have a full court comment on. So that's where we are today on this. We'd like to have individual conversations with the court, but I would like to also bring Mr. Vandergrift into those discussions simply because of his expertise in transportation items, being on the Tech Stop board and also a participant in RTC.
You know, I would, I think we've talked about it before, but I would like for us to have a meeting, and maybe we can do it in the form of a workshop after our meeting on the 27th, where we bring the committee together and we as a court actually has an opportunity to sit down and talk with the committee and let them ask whatever questions they may have and let us make any comments that we may have. And then I know that it's going to be important for the committee to move forward as rapidly as possible if we're going to get ready for this on November. But I would really like to allow the committee to give us their thoughts with regards to the need for consultants, what the consultants would do, how we might use the COG staff at the RTC, and I just think that until we've done that, if we make all these decisions before the committee even gets together, it's kind of like, okay, why do we have a committee?
Have the members of the committee been officially notified of their appointment? I spoke with one of my appointees over the weekend, and this person has received no communication about the appointment.
It's my understanding that they have, but let me double check that, because
you might want to take care of that.
This question came up 2 weeks ago, and we were told that that would happen.
I'm looking for. Okay. We'll make sure that the committee is notified. We had intended to utilize the first meeting of the committee to meet with the Commissioners Court at that time. So that's, I don't know if that's on the 27th. It may be the first part of May, but we need to make sure that we don't set meetings that will conflict with the meetings of the Commissioners Court.
Well, I think if we could, if we could meet with them that last week of April, again, I'm not trying to do anything that would delay it, and I don't anticipate this being a real long meeting, but it would be one where at least we all have an opportunity to kind of make sure that we're kind of on the same page and how we're looking at things, and then, if the committee wanted to meet additionally afterwards or whatever, that's up to them, but, if you kind of work that out with Victor, and if we could meet that last week of April.
Yeah, we'd like to move as quickly as possible.
TK, I've been in a number of meetings with the COG staff, and some of our cities that were involved in those meetings, and there seems to be a little bit of misunderstanding between what I would call the three silos of funding on this project. So I think that somebody needs to do a very good job of explaining those silos, particularly the $125 million silo and how that works with multiple entities. And questions would be like, do you make application to the 50-50 silo? And because there are people that think you can make application to the 50-50, the discretionary funds, and all three of them. And I said, well, probably not.
That's not correct.
Probably not going to work that way. But so there's some misunderstanding from some of the cities.
What's the third silo?
The $125 million that is for multiple jurisdictional projects that maybe, go from one city into another city, or have a city, TxDOT, the COG, or somebody like that that's also providing funding and input. So,
Okay, did we set up, and I just apologize, did we set up specific dollar amounts for each one of those, or did we just talk about it in terms of?
And we set up specific dollar amounts.
Yep.
Judge, the way that our policy is set up is that with regard to those three categories, we specifically stated that they were up to certain amounts. And so I believe the commissioner mentioned 125 million. It's up to that amount. So,
yes, the policy divides the $400 million into three categories.
Right.
So if we didn't go up to a certain amount, does that mean it's going to be less than 400 million?
No, the way that we've always done this, it's a policy of the Commissioner's Court when we initially established this. And as we've seen in the 2006 bond package, there are projects that either didn't make, they may not have been, they may have been less than we anticipated. That puts money into different categories once that happens. At any time, the Commissioner's Court can modify its policy.
Well, and that's what I was leading toward is we're not, we've said generally we want to keep 125 here and so much here and so much there. But again, I want to empower the committee to look at that and say, here's our recommendations, our priorities. If that means we need to take a little bit from our discretionary amounts or a little bit from the ones that connect, we can do that. Ultimately, the court will make that decision.
That's correct.
But we can at least, the committee is not locked into, wait a minute, okay, I got to stop here, or, we really would like for you to consider maybe taking this project because we think it's high priority enough to do that. And ultimately, we're going to decide that, but I hope we don't try to tie the hands too much.
Well, I will add that I'm certainly willing to have a conversation about engaging the expertise of consultants. I will want to make sure that whoever it is that we work with, that we are having conversations about equity, right? Wanting to make sure for our smaller cities that find it difficult to compete in these types of bond programs, that we are having an eye for projects that will be very meaningful to them as well as the big cities, and then also just the different modes. I know we're not funding, any like mass transit, but if we're talking about transportation, which is includes roads, but it's also more than roads. So I want to make sure that we are looking,
yes,
looking at that from a broad perspective.
And so I think, Commissioner, that particular statement would be very critical to be made whenever we begin to meet with the committee for the first time, so that there's a clear understanding as to the scope and the breadth of the projects. So the recommendation that I have, if that meets the approval of the court, then that's how we're going to move forward.
That's fine.
Okay?
So
No.
I want to make sure I understand. So you're saying in a few weeks you'll come back with a recommendation?
Oh,
of how we-
absolutely.
Okay.
Yeah, and
In
we'll
a
be
few
talking.
weeks, I hope we're meeting.
Well.
In a
within
few
the
weeks,
next
I
two-
hope we're meeting.
I understand. But yes, we will be talking with all the court members about this throughout the next 2 weeks to get some input individually from you all.
Very good.
Okay.
Thank you.
Thank you, Your Honor.
You bet. Are there any appointments today? There being none, then you have before you the claims, including the addendum.
Move approval of the claims including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Is there any other discussion at this time?
Yes, we have one additional briefing item. That's the legislative update. Ms. Camarino is handing out the memo. I don't know if you all had received that or not. Just some general comments about what's happening in Austin. We're at a point now where that if bills don't get a committee hearing and pushed out of committee, they will not survive the session, at least in their current form. And that indicates also that we need to be very careful. So if we see a Christmas tree type bill, as some of the bills that didn't get out of committee are not placed on those bills. Senate Bill 1, which is a state budget, it came out of the Senate itself, unanimous. It did not have $35 billion in COVID relief funds that the state is slated to receive from the federal government. So we're going to be paying very close attention to what happens to those $35 billion. Senate Bill 10, which is a taxpayer-funded lobbying, we still have some real issues with this. I think we're beginning to water some of that down. The problem is with the current substitute, it does not allow statewide associations that have lobbyists or people that lobby, such as tax, CUC, they are prohibited from influencing property tax system related legislation. They're trying to block local comments, at least association type comment, as it relates to property tax. And obviously, that's the major source of funding for both cities and counties. Bail reform and pretrial risk assessment tools, they are moving forward on that. I believe that's a fairly good bill. And Commissioner Brooks, I know that you've been very interested in that, so if you might want to read that particular item in that memo. We've been working on an issue on quarantine leave legislation, and that's something that we're still not satisfied with what the bill looks like. It basically allows a supervisor to authorize one of his or direct one of its their employees to be quarantined, and the county would have to pay not only the quarantine costs or the housing costs, but all, if any, but also pay. And we're trying to modify that so that counties would develop a policy based on recommendations from the health authority or public health director. And so we're still working on that particular item. Law enforcement funding, or the defunding of police. We are currently, that bill is, as far as counties are concerned, is in pretty good shape. We had them removed initially, the detention officers, because our jails are governed by the Texas Jail Commission, and so we have to abide by their recommendations. And we're at this point now where the county is totally removed from that because of the number of law enforcement agencies we have in the county, that being the Sheriff's Department and all 8 constables and the Fire Marshal's office. So I'm sorry that we got this to you a little late. I think we might have mailed it to you. So, members of the court, I'll be more than happy to attempt to answer any questions you may have about this or any other legislative issue.
I want to comment on the taxpayer-funded lobbying. We have, for all the years that I've been on the court, we always say that TAC is lobbying. Having just recently gone on the TAC board, and Susan Redford, our current executive director, really looking at that. If you look at the creation, TAC is a unicorn. from a standpoint that it was actually created by the legislature. And in that creation, it is the only association that their employees are actually a part of TCDRS. But they are very specifically excluded from doing lobbying of any type. They can provide information upon request, but they cannot lobby in any way, shape, or form. And I know we always refer to TAC doing that, and most of the time when we do that, we are really thinking of what Jim Allison does. And Jim Allison is a contractor for the Judges and Commissioners Association. And as such, he provides us with lobbying. He takes care of organizing the education requirements that we have. And I specifically, this is just Glenn Whitley opinion, not anybody else, but I think a lot of this taxpayer-funded lobbying and the way it's now being written is targeted at Jim Allison. Because he is independent and he's contracting with us. The other folks who are lobbyists within our associations, CUC is Adam Haynes, other associations have people who are employees. Russell, for our standpoint, at least as it's going through right now, would be exempted because they're employees. But it's important that TAC has governmental affairs people on it, or that they employ, but they're providing information only. They may even be registered lobbyists. I don't know that they're registered lobbyists. I don't think they are.
Not all of them.
Jim Allison is a smart guy.
Well, Jim Allison
can figure out how to get in compliance with whatever the legislation.
I think that Jim is basically been a smart guy about as long as he's wanting to continue to. So next year is the 100-year anniversary of the Judges and Commissioner Association. But I'm just saying that I think a lot of that is targeted toward Jim. And you're right, he is an extremely sharp guy. He knows more than what most of those people have, he's forgot more than what they know.
Yeah.
But he was also very much at the forefront of opposing the revenue measures that the legislature put into play, and so I think they're trying to exact some punishment from that perspective. But, TAC, we need to try to remember, because there's a lot of people out there that's putting a target on TAC for the same reason. And there was a bill last time that was put forth in an effort to take the exemption away from TAC, which would have also affected all of their employees' ability to continue in their pension plans. So I just say that.
We just need to be more careful.
Yes.
About the language that we use in describing what organizations do.
That's exactly right.
More precise in the language that we
One
use.
other thing about next week, I will probably participate via video. And so if I need to get to figure out exactly how that happens, Commissioner Brooks, I think you'll be the senior member here. So
I may be on
video.
Telephone.
You may be on telephone.
Yeah.
Does that create any problem being on telephone?
Because next week is West Texas.
West Texas starts on Tuesday of next week.
As it currently stands with the governor's relaxation of the Open Meetings Act stuff, there has not been a full relaxation as far as telephone. You still have to have be unable to make it because based on some sort of calamity. I think we may have an issue with the telephone. I'll take a look at that legislation again. I'll take a look at that relaxation again. It may have to be by audio and video. I know there's legislation going through now to relax that, or to codify some of the governor's changes to the Open Meetings Act. And I'm continually monitoring that. But I think as of now, before that legislation, we may have an issue with the telephone, but I'll take a look again and circle back around to you, Commissioner.
So you think it may have to be video in order for it to work?
Yes, sir.
Okay, well, and let me know, I'm gonna get with IT or whatever, because currently what I would just use is my computer with the camera on it
And that'll work just fine.
Hotspot.
Absolutely.
that'll work, yeah, a hotspot. Yeah.
I'll be in transit.
And now, the relaxation does mean that you do not have to have a physical quorum here present in the courtroom. So you could still preside over it, Judge, even if you're going to do it by video.
I do not want to, no, I mean, I understand what you're saying, but we've been here when there's just two of us, and I don't think you can do it justice presiding if you're not here. So
Absolutely, that's
my
clear
preference would
decision.
be for Commissioner Brooks to preside at that point in time, and that way he can operate the phone as it needs to be operated.
Absolutely. And so I'll verify that and get back with the court as well.
Suffer the slings and arrows.
Yeah. Come on down, Trevor. Is that all today? Okay, then we'll recess our open meeting, proceed to close to discuss items exempted under section 551.071, 072, 074, 076, and 087 of the Texas Government Code. Having returned from our closed session, there being no business to conduct at this time, we stand adjourned.